Welcome to the Mama Stay Fit YouTube channel. In this video, we're going to be discussing how you could use exercise to reduce your risk of developing gestational diabetes or delay the onset or severity of it by up to 39% with resistance training, which is strength training, so lifting with weights or bands, and or with aerobic training, which is more of that cardio training that you can do throughout your pregnancy. So before we get into this episode, if you have any questions about gestational diabetes, such as how is it diagnosed, why am I being tested for it, what are the risks and complications associated with it, or really any question related to gestational diabetes, drop it down in the comments below. We're doing a longer podcast episode all about gestational diabetes, and we want to be sure that we answer all of your questions. Hey, for those of you that don't know me, my name is Gina. I'm a birth doula, I'm a perinatal fitness trainer, and I specialize in helping folks understand how they can utilize exercise throughout their pregnancy, to have a stronger pregnancy, to have a pain-free pregnancy as they prepare for birth, and then also help them recover after birth.
And I'm Roxanne. I'm a labor and delivery nurse with over 8 years experience as well as a student midwife. So let's first start with what exactly is gestational diabetes. Just a really quick definition of gestational diabetes is diabetes that occurs during pregnancy, and this is some sort of insulin resistance. So you're still able to produce the insulin with your pancreas, but it's just not enough insulin to control your blood sugar, so it's leading to high elevated blood sugars. But what exactly is insulin and why is it so important? So insulin is the key to breaking down glucose and allowing it to enter the cells. We need glucose in our bodies because this is how our cells get energy. So the only way though that glucose can enter those cells is with insulin. Insulin almost is the key to the glucose getting into our cells to provide energy. So during pregnancy, we all have somewhat of an insulin resistance, and this is beneficial for our babies because it's allowing nutrients to pass to our babies as well as allow baby to grow because insulin can help babies grow. But it is concerning when the insulin resistance gets to the point that our body cannot keep up with the insulin demand. So the pancreas can only make insulin so quickly or so fast. And so when that body and the glucose levels in our blood surpass the amount of insulin that our body can create to get that glucose into our cells, that is when it's a concern. And that's when we need to intervene with either medication or implementing exercise. So why is exercise so beneficial for gestational diabetes?
So there's two different types of exercise that you can incorporate into your prenatal routine to help support either preventing gestational diabetes or if you have it, helping to manage it so that you don't need insulin. You can do resistance training, which is where you're lifting weights, using bands. You're essentially using external support to increase the intensity on your body. And then you can also do aerobic training, which is going to be more of that cardio training. So being on the elliptical, the stationary bike, going for walks, or even doing circuit training, where you're doing a lot of different exercises without a lot of rest to get your heart rate elevated. So both of these can be utilized together to help you manage if you have gestational diabetes or even prevent it altogether throughout your pregnancy. And there's a number of reasons why this can be a really effective protocol. So in studies that look at both diet and exercise as opposed to just diet, they found that folks that were doing both diet and exercise had decreased post-glucose levels, so their blood level was more stabilized after meals. For those with gestational diabetes, their needs for insulin medication reduced. In addition, in the diet and exercise group, their hemoglobin A1C levels were also reduced. So Roxanne, can you explain what a hemoglobin A1C level is? How is it tested? And what are good levels for somebody?
So a hemoglobin A1C, or sometimes called an A1C, is just a simple lab draw that they do that averages out your blood sugar levels for the past 3 months. And based off of those, it gives you a percentage. So between pretty much anything below 5.5% is good. You have well-controlled blood sugars. Between 5.5 to 6.5 is pre-diabetic. So your blood sugars were kind of a little bit uncontrolled. You're not diabetic, but we should probably start addressing insulin resistance. And then anything over 6.5 is diabetic. So we have diabetes of some sort of, whether it's insulin resistance or we're not making insulin enough. Anything over 9 is concerning that there is some severe, uncontrolled blood sugars and might lead to some severe consequences or long-term consequences associated with diabetes.
So exercising throughout your pregnancy, especially if you do have a gestational diabetes diagnosis, can help to manage your blood sugar levels. It can help to reduce your level of A1C levels. It can also help reduce your needs for insulin medication. So let's break down, how does exercise exactly help with managing your insulin levels? How does it help you manage your blood sugar and potentially prevent gestational diabetes, or help you manage it if you do develop it? And so the exact mechanism that helps exercise support this is not totally known, but there are some things that we can hypothesize that probably contribute towards this. So first, it's important to understand that pregnancy is a state of insulin resistance. So insulin resistance, again, means that our insulin is not very effective at breaking down glucose. And because our body can only make so much insulin, if that insulin is not doing a good job of breaking down the glucose, we're going to have too much in our blood, which is going to elevate our blood sugar levels, which would not be optimal for us. We want to maintain a fairly regulated blood sugar level, or be able to bring it down to normal levels very quickly. And so if we have insulin resistance, the insulin is not effective at doing that, and we can only make so much. So exercise, the first thing that's going to do is going to increase our insulin sensitivity, which means that our insulin is going to be much more effective at breaking down that glucose. So that's like the first thing that exercise is going to do. The way that it's doing that is, one, it's going to increase our GLUT4 levels, which is the transporter that takes insulin and glucose into our cells. So insulin is like the key that brings our glucose into our cells, and the GLUT4 is the little transporter, or the car that's bringing it into the little garage cell. So it's important that we have GLUT4 to help us with that transport process. It's also going to increase the sensitivity of our GLUT4 to insulin, so it's going to make it more effective at helping the insulin move. So we have insulin sensitivity that improves our insulin effectiveness, and then we have GLUT4 insulin sensitivity improving, which helps it be more effective at bringing the insulin and the glucose into the cell. So that system is going to be a lot more effective. Glycogen synthase is a key enzyme in glycogenesis, which means we're breaking down the glucose into glycogen, which is what we store glucose as. And so if we can't break down that glucose into a storable form, we're going to have elevated blood levels. And so improving this amount of enzyme is going to help break down the glucose into something that we can store in our muscles. So the combination of those three things is going to help us have better insulin sensitivity throughout our pregnancy. The other thing that exercise is doing is it's increasing the uptake of glucose into our muscles. And so again, glucose is the energy that our muscles need. We have increased GLUT4 transporters that are helping to bring the glucose into the muscles. We have more enzymes that are helping to break down the glucose into a storable form. And so there are a lot of benefits at a cellular level of exercising throughout your pregnancy to help support insulin sensitivity. But what type of exercise should you do, and how does aerobic training versus resistance training help you manage gestational diabetes or prevent it altogether throughout your pregnancy? Aerobic training and resistance training have different metabolic effects on our body. And so resistance training is going to increase our muscle mass. So when you lift weights, it's going to make your muscles bigger and it's going to make them stronger. Skeletal muscle mass is the largest mass of insulin-sensitive tissue in our body. So when we have more muscle mass, we have more tissues that are readily available to help with our insulin sensitivity, because we have more muscles that are readily available to take more of that glucose. Increased muscle mass is also going to improve our glycemic control, which is managing our blood sugar levels. With aerobic training, which is that cardio training that's increasing your heart rate, this tends to decrease fat around our midsection, which is going to help improve our insulin sensitivity, which again, insulin sensitivity means that our insulin is better at breaking down that glucose. The combination of resistance and aerobic training can really help you to prevent or to manage gestational diabetes, because the increase in muscle mass improves our ability to use that glucose, while the decrease in fat tends to increase our insulin sensitivity, which helps us break down that glucose to help manage our blood sugar levels. And so what should you do for your workouts? ACOG, which is the governing body of obstetrics, recommends at the minimum 150 minutes of moderate intensity exercise per week. So this is at least 5 times a week for about 30 minutes. But for most of us, we're not even meeting these minimum recommendations. And again, these are the minimum. So you could probably do a little bit more. A lot of research supports doing 2 to 3 times of aerobic training per week and 2 to 3 times of resistance training per week at a moderate intensity level can be really beneficial to decreasing your risk of developing gestational diabetes and also decreasing the severity or the onset of gestational diabetes. What moderate intensity level tends to look like for aerobic training, if you're talking to somebody, you can speak about a sentence before you get winded. So keep that in mind when you're doing more of your cardio activity. And then moderate intensity for lifting weights or resistance training is you usually have like a few more reps in you that you can do. But if you did any more than that, you'll probably start to feel or your form will start to be compromised. So it's still challenging. Both of them are still very challenging, but they're not completely overwhelming. You still have stuff left in the tank at the end of your workout. And so if you want to work out throughout your pregnancy, but you're feeling unsure what to even do, you can join our prenatal fitness programs. We offer our prenatal fitness programs in two main formats. One is going to be app-based, where it's a list of exercise with demo videos, and you work out at your own pace. This is a great option for somebody that tends to want to work out in a gym setting, although we do have a long version of the program and a mini version, which would be a great option for at home. If you prefer to follow a full-length workout video as you work out at the same time, our on-demand program can be a great option for you, or even our yoga program. You can check out all of our prenatal fitness programs on our website at mamastayfit.com/fitness-programs, and you can use code YouTube10 to get 10% off. And you can bundle our prenatal fitness program with our childbirth ed and pellet for prep for birth course and save an additional 15% off.
So we just talked about all of these ways that we can decrease our risk for gestational diabetes or delay the onset of gestational diabetes using exercise. But why is it so important to do that? And this is because gestational diabetes comes with risk associated with not just your baby, but also you as well. So for baby, this can cause baby to grow too large because babies, your insulin levels do not cross over to baby. So it's not like the insulin is crossing over to baby when it's really elevated. Your baby's producing their own insulin based on the amount of glucose that's being transported to them from you. So if you have very elevated glucose levels, that means that baby is producing more insulin to, again, break down the glucose that they're getting from you. But this is concerning because insulin is also a growth hormone. So this can cause baby to grow too large for your body. And really, most of the time, we're not going to grow a baby that's too large unless we have some sort of complications, such as gestational diabetes, that could increase the size than they normally would have grown, especially in their shoulders. So they normally will have like larger type shoulders. Some people will call them like linebacker shoulders, which could increase that risk of shoulder dystocia happening. And this is with uncontrolled diabetes. With gestational diabetes for us, it also increases our risk of developing hypertension, whether you had chronic hypertension maybe in the past or a new onset hypertension, which is elevated blood pressures. It could either be gestational hypertension or even something called preeclampsia, which is a more severe form of gestational hypertension. And all of these come with different risk factors. So not only by exercising during pregnancy can we prevent gestational diabetes from happening potentially, but it could also decrease the severity if it does develop.
Exercising in combination with diet throughout your pregnancy can help you manage your blood sugar levels. It can help you maintain insulin sensitivity and then also decrease the severity of gestational diabetes if you do develop it. If you want to learn more from us, be sure to check out our online prenatal fitness programs and childbirth education course, and be sure to listen to our podcast episode where we discuss all about gestational diabetes. And again, if you have any questions, be sure to drop them down in the comment box below so that we can be sure that we answer them in our upcoming episode. Thank you so much for watching this video. If you enjoyed this video, be sure to like and subscribe to our channel so that you get notified whenever we release new videos. We release 1 to 2 new workout videos a week and 1 to 2 educational videos a week as well.